Hello, everyone. I'm here with my colleagues from the My Mind or Humanity Global Mental Health Campaign, and we're going to share some lessons that we've learned over the past 3 years. My Mind or Humanity is a group of young mental health advocates from across the globe that work to raise young people's voices in global mental health. The group and its creative global campaign was launched in 2018 alongside the publication of the Lancet Commission report on global mental health and sustainable development. The report reframes the traditional mental health research agenda and emphasizes the importance of involving young people, including those with lived experience, to address barriers to accessing care, social inclusion, and full citizenship. Our group offers creative and innovative ways to engage and involve global youth in the mental health debate. Our core aims are to reduce stigma and promote the notion that mental health is a fundamental part of being human, to integrate young people's voices, or values and experiences into public debate, research, mental health practice, and policy making, and to educate and inspire young people to take action and promote well-being in their communities. Mental illness continues to be a leading contributing factor to NCDs, emphasizing a need for greater awareness and investment to prevent emerging mental health disruptions. Our implementation framework continues to successfully pivot on social and digital media to empower young people from across the globe while advancing their perspectives and prioritizing their mental health needs. With the pandemic causing dramatic shifts towards more online services, the recommendations we are going to share are to help foster better engagement with young people in digital mental health.
Our first recommendation is how to engage young people in advocacy, youth development, and policy in digital mental health. Over the past 3 years, our group has involved and engaged young people worldwide through a series of digital initiatives. On our Instagram alone, we have amassed an organic following of over 26,000 people and engaged further hundreds of thousands worldwide across different initiatives and campaigns. We have surveyed thousands of young people in low and middle-income countries and learned that increasing mental health literacy and reducing stigma around mental health are key priorities. Social media platforms can help build online community conversations about mental health and gather young people's perspectives on pressing mental health matters facing youth today. To engage young people meaningfully in different countries, we recommend using social media to do the following. The first recommendation: disseminate up-to-date data information about mental health and mental illnesses and support sources in different languages so that we are ensuring cultural relevance and sensitivity. Also use different platforms, including Instagram, Facebook, TikTok, and others. Use digital assets made by or co-produced with youth, including animations and illustrations. Digital assets like protest graphics can also be used to show solidarity with global social movements like Black Lives Matter, which speaks out against mentally distressing and unjust social structures. The second recommendation is going beyond just sharing information to engage young people in active and inclusive ways. For example, through festivals and challenges. Our group hosted a mental health poetry festival with over 850 submissions from online Instagram users in 6 different languages and over 100,000 online engagements worldwide. Visual assets produced based on their poems continue to inspire thousands of young people worldwide. To increase social media outreach, use awareness calendar days like World Mental Health Day to launch virtual challenges and to encourage participation in challenges. Include small incentives. We have found non-monetary incentives such as public recognition on social media to be motivating factors for youth engagement. To increase access, consider approaches that allow for low bandwidth and data consumption. For example, we have hosted WhatsApp webinars or webinars, if you may, in Kenya using instant messaging and voice recording during the COVID-19 pandemic. The online sessions focused on mental health implications of the COVID-19 pandemic, like stress and anxiety, and were extremely popular and well-liked. Also, mixing talks like lived experience sharing and art performances make events more attractive and accessible to the youth. Wellness breaks can also help instill mindfulness, promote concentration, and overcome screen fatigue. Our third recommendation is connect young people with other stakeholders, including service providers, nonprofits, and policymakers. Partnerships are critical to drive change. For example, in our webinars in Kenya, webinars, remember, are the WhatsApp webinars, involve local mental health practitioners and student-led university associations. We have also engaged youth in high-level conversations. In partnership with the United Kingdom Department of Health and Social Care, we hosted an online campaign called The World Needs. We invited charity representatives, politicians, young people, and other stakeholders to share their priorities and needs with regards to mental health in advance of the Global Ministerial Mental Health Summit in 2018. To generate discussion and make youth and policy priorities visible, tagged posts were displayed on electronic display panels during the summit. Finally, we have co-hosted a solution workshop which involved dissecting the recommendations from our policy brief. Young people will transform global mental health to create practical action points relevant to specific countries. Some of the lessons that we've learned over time include the fact that there are positive youth attitudes towards the use of social media to promote active engagement with mental health, as young people often use these platforms on a daily basis for information and support. Creative skill-based activities prove to be one of the most effective ways to reach and engage young people about mental health on social media. Overcoming access and language barriers is crucial for inclusive and effective communication about mental health on social media, and integrating multiple stakeholders in social media initiatives is key to fully integrate young people's perspectives into discussion making and drive sustainable change.
We recommend researchers, funders, practitioners, developers, and other research stakeholders to integrate young people into the design of digital mental health research and interventions. For example, through young people's advisory groups or virtual or in-person consultations. In particular, set priorities for research with youth and engage young people, like mental health advocates and those with lived experience, to participate in the review process for grant proposals. For example, our group has acted as reviewer for the most recent Grand Challenges Canada Global Mental Health Call. Co-produce new methods with youth and use existing methodologies that appeal to young people, such as arts-based approaches. For example, the Empathy Project has used photo voice and art exhibitions to investigate how young people perceive the relationship between their built environment and mental health behaviors. Use accessible platforms to facilitate inclusion. For example, we worked together with UNICEF to co-produce a cross-sectional survey study to understand young people's perspectives around mental health, and through the use of an accessible digital platform, you report we managed to reach over 40,000 youth in low and middle income countries and understand their views. Our group made sure the survey was relevant across countries and helped disseminate results to policymakers worldwide. Hold analysis sessions and allow young evaluators to participate and learn. Add young people to journal editorial boards and engage them as youth reviewers. Involve young people in the co-design of mental health training resources, mental health toolkits and interventions, and educate adults on youth perspectives about health systems. For example, members of My Minor Humanity have co-designed an online peer support program for youth during COVID-19. The lessons we've learned. By acknowledging and supporting the involvement of diverse groups of youth in academic research, it is easier to design research and interventions. It is easier to design research and interventions that are more inclusive, meaningful, accessible, and appealing to young people. Through strengthening the capacity of young persons, we have been able to co-produce and co-design research interventions Providing young people with formal mentorship and learning opportunities is key. Clearly defining roles and responsibilities of young people in academic research is important and means they feel valued and better equipped to contribute. Paying youth for their time and expertise leads to more equitable and youth-friendly research activities and supports retention of youth participants. The My Minor Humanity campaign has built a global mental health following that has proved resourceful in meaningfully involving young people using both online and offline engagement approaches. We have filled the knowledge gap on youth mental health perspectives and amplified the mental health conversation in social spaces through robust capacity building initiatives, which have allowed us as a team to promote mental health and well-being and participate effectively in multi-stakeholder processes. We acknowledge that we are a part of a larger system driving mental health interventions. Our impact is a direct outcome of our effective cross-cultural advocacy practices, which are mainly youth-driven. The recommendations we have proposed have allowed us to enhance digital mental health support by offering timely support to young people's mental health needs. But to sustain our efforts, we recognize that other types of knowledge from the global south must be included to measure how useful our practices are and to improve the quality of our social media assets and knowledge approaches. Thank you.